Do you know someone with diabetes, or does it run in your family? Do you suffer from diabetes? Because diabetes is so common, the answer to at least one of these questions is likely yes. Diabetes is one of the costliest diseases in the United States, affecting over 10% of the population. Diabetes is a leading cause of heart disease, stroke, poor circulation, poor wound healing, and a primary cause of kidney disease. So how can you determine if you're experiencing symptoms of diabetes? Watch till the end to find out. Here are the 10 warning signs of diabetes that you should never overlook. Number 1. Frequent urination. When you have diabetes and have elevated levels of glucose or sugar in your blood, your body tries to eliminate it and pass it through your urine. When you eliminate the glucose, you also release water from your body, which can cause dehydration. It varies, but most people will use the restroom 6 or 7 times a day. If you're using the restroom to the point where it is interfering with your daily life, especially at night, you may be experiencing frequent urination, which could be a warning sign of diabetes. Number 2. Increased hunger. Because diabetes causes improper energy utilization, you may find yourself experiencing increased hunger. This is because your body is unable to process the sugar or glucose for energy, so you may continue to feel hungry after a meal. Number 3. Unintended weight loss. If you're losing weight unintentionally, it could be a warning sign. When you have high blood sugar or raised blood glucose, you have excess sugar in your blood. But if the sugar is not used by your cells, your body is not obtaining enough energy. To acquire energy, you continue to eat, but because your body is unable to metabolize sugar properly, you do not get the energy you need and lose weight. Diabetes and hyperglycemia patients can lose a significant amount of weight. If you experience unexpected weight loss, this could be an indication of diabetes. Number 4. Blurred vision. Diabetes or high blood sugar levels can cause blurry vision. Shifts in the fluid can cause changes in the shape of the eye's lens. If detected early enough, the hazy vision can be restored if the diabetes is controlled. Long-term untreated diabetes, on the other hand, can cause permanent eye damage known as diabetic retinopathy. So you do not want to overlook this potentially transient warning sign and risk a potential permanent condition. Number 5. Fatigue. When you have diabetes, your body does not effectively use sugar for energy. So even though you have high blood sugar, you are not obtaining enough energy, which can contribute to exhaustion and fatigue. Dehydration may also contribute to fatigue. If you wake up frequently in the middle of the night to use the restroom, this can alter your sleep patterns and lead to weariness. While weariness can be a symptom of a variety of diseases, it can also be a warning sign of diabetes. Number 6. Increased thirst. Along with frequent urination, you may also experience excessive thirst. This is because your body is trying to compensate for the loss of fluids. If you are constantly thirsty, even after drinking fluids, you could have polydyspepsia, or excessive thirst, which may be a diabetes warning sign. Number 7. Frequent infections. Diabetes patients' immune systems can be impaired, and we all have some yeast in our bodies. Yeast is addicted to sugar. If you have diabetes and high blood sugar, the yeast can proliferate, causing infections. Diabetes symptoms also include frequent urinary tract and skin infections. All 3 can be warning signs that the immune system is impaired and infections are thriving in the body. Number 8. Improper wound healing. Diabetes or elevated blood sugar compromises circulation and causes wounds to heal more slowly. If you notice that you have cuts or wounds that are taking a while to heal, this could be an indication of diabetes. If this is not recognized as a warning sign early enough and long-term diabetes develops, poor wound healing can lead to a loss of extremities. If you notice wounds healing slowly, please consult your doctor, as this could be a sign of diabetes. Number 9. Tingling in the hands and feet. If you have tingling in your toes and feet, or tingling and numbness in your fingers, this could be an indication of diabetic peripheral neuropathy. If you are experiencing nerve tingling, it could be an indication of diabetes. it is important that you pay attention to your body and check with your doctor if you're experiencing symptoms. Number 10. Skin changes. If you have dry and itchy skin, it could be an indication of diabetes. Also, dark patches of skin on the neck or under the armpits can be an indicator of insulin resistance, as well as a warning sign of diabetes. Types of diabetes. Diabetes is a disease that affects how your body uses sugar. The cells in your body require sugar to function correctly. The hormone insulin is required for sugar to enter your cells. Insulin functions like a key that opens the door for sugar or glucose to enter your cells. If your body does not have enough insulin, you do not have the keys to unlock the cells, so glucose cannot enter the cells and you do not have enough energy. If you have enough insulin but your body does not respond to it, the sugar will not enter the cells. This is what occurs during diabetes. There is excess sugar in the blood and increased glucose or hyperglycemia, but the sugar is unable to enter the cells. Diabetes can be caused by either genetic or environmental factors. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the immune system of the body targets and kills the cells in the pancreas that processes insulin. As a result, patients with type 1 diabetes are unable to manufacture insulin and must maintain their blood sugar levels using insulin injections or an insulin pump. Children and young people are frequently diagnosed with type 1 diabetes, which is usually incurable. Type 2 diabetes. A metabolic disease known as type 2 diabetes occurs when the body is unable to use and retain glucose efficiently. This can be because of insulin resistance or insulin deficiency. Type 2 diabetes is more prevalent than type 1 diabetes, and although it can also affect people who are at a healthy weight, is frequently linked to obesity or inactivity. In addition to treatment with drugs or insulin injections, type 2 diabetes can frequently be controlled by lifestyle modifications such as diet and exercise. Gestational diabetes. Gestational diabetes normally disappears after the birth of the child. Due to the increased demands of pregnancy, it happens when the body is unable to create enough insulin, resulting in high blood sugar levels. Gestational diabetes is normally treated by making lifestyle adjustments such as dietary and exercise modifications, and in some situations by administering insulin injections. It can raise the risk of problems for both the mother and the unborn child. Prediabetes. Prediabetes is when blood sugar levels that are higher than normal but not high enough to be classified as type 2 diabetes. Type 2 diabetes, heart disease, and stroke risk factors are all increased by prediabetes. Prediabetes can frequently be reversed by making lifestyle adjustments. Medication may occasionally be used to control blood sugar levels. If you are experiencing any of the warning signs, it is important to consult your doctor. The key is to listen to your body and never ignore warning signs and symptoms. Early diagnosis and treatment can help. Thank you for watching. If you enjoyed the video, hit the like button. Please share and subscribe to our channel if you haven't already done so. If you want to be notified of new uploads, hit the bell icon when subscribing.